This nursing mindset video is about inflammation. Inflammation is the body's protective, non-specific response to injury, infection, or tissue damage. In other words, inflammation is not automatically bad. Its purpose is to eliminate harmful stimuli, limit further injury, and begin tissue repair. So the question nurses should ask is this inflammatory response helping the patient heal, or is it beginning to cause harm? Let's walk through what happens. First, an injury occurs. This may be caused by trauma, infection, toxins, or another irritant. Next, blood vessels dilate. This increases blood flow to the injured area. Then, capillary permeability increases, allowing fluid, proteins, and white blood cells to leave the bloodstream and move into the tissue. That process creates the signs we assess: redness, warmth, swelling, pain, and sometimes loss of function. If the wound is open, we may also see exudate. These findings are the body's visible clues that healing has begun. But we also need to decide whether inflammation is local or systemic. Localized inflammation affects one area, such as redness and swelling around a wound. Systemic inflammation affects the whole body and may include fever, fatigue, malaise, and an elevated white blood cell count. Systemic findings are more concerning because they may indicate the body is struggling to control the inflammatory process. As nurses, our interventions focus on controlling inflammation while still allowing healing to occur. Non-pharmacologic interventions include RICE, rest, ice, compression, and elevation. Medications may also be used, such as NSAIDs, aspirin, or corticosteroids. But remember, not every patient with inflammation needs medication. Mild inflammation may improve with rest, ice, compression, elevation, and time. Finally, we evaluate. We reassess for decreased redness, warmth, swelling, and pain. We look for improved function, appropriate wound healing, decreased drainage, and improvement in systemic signs or labs when available. Then we ask, was the SMART goal met? If not, what needs to change? That is nursing mindset. Nurses do not just treat inflammation. We assess, act, and reassess to determine whether the patient is progressing towards healing or towards harm. Every safe nursing decision begins with the right mindset. So let's keep developing your nursing mindset.